You're gonna get a lot of beam hardening artifact. Guess I brought the stick back. Up here is gonna be the right common carotid, left common carotid down here. Basically enhancement of the thyroid gland. This is in the case of the patient's right side, that screen's moving, huh? Is the right internal jugular vein over here. Basically, that's all you're gonna really see in this upper level. Down here, this really is a great slice over here. Going from anterior to posterior, here's what we have. We have right common carotid. We have right internal jugular vein. We have right subclavian vein, right subclavian artery, this is a rib. We have, of course, esophagus, trachea, left common carotid over here, left subclavian vein, artery rather, and then the subclavian veins kind of coming off this way, and eventually it's going to join up with we don't see it because of the amount of contrast media, with the left internal jugular vein forming the brachiocephalic vein. Muscle-wise, we have the pectoralis major and minor. Then at this point, what we have, we get back a little bit, we have what's remaining of subclavian vein. Already we have transition forming the right brachiocephalic vein. Going through further transition, we have the right common carotid, eventually going to meet up with the right subclavian artery. Left common carotid, left subclavian, and left already formed brachiocephalic vein. Going down. Right brachiocephalic vein, these guys are going through transition. That's what's left of right common carotid. Right subclavian artery. Keep in mind that right subclavian artery seen on partial volume is seen here and here. Left common carotid, left subclavian artery, left brachiocephalic vein, trachea, esophagus. Traps are back here, but we don't see them clearly. Right brachiocephalic vein, transition, getting ready to form the brachiocephalic artery. Left brachiocephalic vein arching through the anterior mediastinum. Left common carotid, left subclavian artery, trachea, esophagus. Again, the pecs up here. What about the traps back over here? We don't quite see the lats. Right brachiocephalic vein, left brachiocephalic vein. Going from patient right to left, we have brachiocephalic artery, left common carotid, and left subclavian artery. Trachea, esophagus, pecs, traps back over here. Again, we don't quite see the lats yet very well on this one. Transition, for the most part, we're not getting a lot of information that's concise, but what we do have is right brachiocephalic vein, left almost joining it. This is the remnant of the thymus gland that we refer to as mediastinal fat. What was at one point brachiocephalic artery, left common carotid, and left subclavian artery. Trachea, esophagus. I'll put out one more if I may. Here, we've already transitioned now into SVC. Keep in mind the brachiocephalic veins will form as we work our way down. The SVC, mediastinal fat, aortic arch, trachea, esophagus. Transition, this is starting to open up in this area. So we have SVC, mediastinal fat, trachea, although not open really well, esophagus posterior to it. Maybe early signs of azygos vein. We'll keep an eye on that. And these will soon transition into both the ascending, descending aorta, which we have right now. So going on this side out from the right to left, we have SVC. I have ascending aorta. I have descending aorta. This area we're going to identify as the aortal pulmonary window, important landmark, trachea, esophagus, over here, back over here somewhere, azygos vein, perhaps a little bit of lats out here and here. We'll get into more rotator cuff as we get into the extremities later in the semester. SVC, ascending aorta, trunk of pulmonary artery, transition here involving the trachea, descending aorta over here, maybe what's at one point the azygos vein, not very clearly seen here at this level. Here we can see it better over here. Here's azygos vein over here. This is the biocular appearance of the carina. Once again, SVC, aorta. To break it into components, we have the trunk of the pulmonary artery. Here's left pulmonary artery, and to a smaller degree, right pulmonary artery, descending aorta. Here we have azygos vein. This little dot right over here is an important landmark. It's called the arch of the azygos vein. As it brings its blood up from the GI tract, it's going to eventually dump it into SVC, ascending aorta, descending aorta, transition. So we have a little bit of the right and left still continuing, left pulmonary artery. The primary bronchus over here, as I said before, azygos, and the descending aorta. Here's our lats out here and out here. First chamber of the heart starting to show up over here. So keep in mind the left atrium is always going to be adjacent to the spine. So what we have going into it in a smaller degree is going to be pulmonary veins, not so much on this side, but a little bit going in from this end. What's left of ascending aorta, descending aorta, just getting ready to form the right atrium right over here. Pulmonary veins over here. What's left of left atrium, right atrium. The ventricles are just starting to come into our field of view. And here's the other aspect of the azygos vein. Left atrium, residual of pulmonary veins. Here is our inner ventricular septum, right over here. Left ventricle, somewhat right ventricle. Pretty much hard to pick up now at this point any real detail of right atrium. At this point we're looking at ventricles, so what we have is the inner ventricular septum right over here. The region on the left ventricle, right ventricle, azygos vein, the descending aorta. Traps are better seen back over here. And that's it.